Have you ever measured your blood pressure first thing in the morning and wondered why it's higher than it is later in the day? You're not imagining it, and you're definitely not alone. If you're over 50, there's a good chance you've noticed this pattern yourself. You wake up, you check your numbers, and they're higher than you expected. Maybe that's made you a little anxious. Maybe you've even wondered if something is wrong with your heart. By the end of this video, you'll understand exactly why this happens, whether it's something to worry about, and what you can actually do about it. So, let's get into it.
Your body isn't a machine that runs the same way 24 hours a day. It runs on an internal clock, something scientists call your circadian rhythm. This clock controls far more than just when you feel sleepy or awake. It also quietly adjusts your heart rate, your hormone levels, and yes, your blood pressure all day long. In the hours before you even open your eyes, your body is already preparing you for the day ahead. It starts releasing a hormone called cortisol. You may have heard cortisol called the stress hormone, but that's a bit of an oversimplification. Cortisol is really more like your body's built-in alarm clock. It rises naturally in the early morning to help wake you up and give you energy. At the same time, your body releases adrenaline, the hormone responsible for that alert, ready-to-go feeling. Together, cortisol and adrenaline tell your heart to beat a little faster and tell your blood vessels to tighten slightly. That combination pushes your blood pressure upward, sometimes by a noticeable amount, right around the time you wake up. Think of it like your body revving the engine before pulling out of the driveway. You're about to sit up, stand, walk, maybe make coffee, maybe rush to get ready for the day. Your cardiovascular system is simply gearing up for that activity. This is completely normal. In fact, doctors have a name for it: the morning surge. For most healthy people, this rise in blood pressure is nothing more than your body doing exactly what it's supposed to do. It's not a malfunction. It's a feature, not a flaw. But here's where it gets a little more interesting, and it's the reason so many doctors pay close attention to morning numbers specifically. Research has consistently shown that heart attacks, strokes, and other serious cardiovascular events happen more frequently in the morning hours than at any other time of day. This isn't a coincidence. It's connected to the very same surge we just talked about. Now, before you start feeling uneasy, let's be clear about something important. This doesn't mean everyone with a higher morning blood pressure reading is in danger. Far from it. Millions of people experience a completely normal morning rise every single day without any problems at all. What matters isn't that your blood pressure goes up a bit in the morning. What matters is how much it goes up and whether it stays elevated in a way that puts extra strain on your heart and blood vessels over time. A gentle, expected rise is your body doing its job. A sharp extreme spike, especially one that happens repeatedly, is what researchers are more concerned about. So who should be paying a little closer attention to this pattern? If you're over 50, your blood vessels have naturally become a bit less flexible than they were in your 20s or 30s, which can make blood pressure changes more pronounced. If you already have high blood pressure, diabetes, or you're carrying extra weight, your cardiovascular system may be working harder overall, which can amplify that morning rise. Smoking is another factor since it affects blood vessel function throughout the day, not just when you're actually smoking. Sleep apnea is a big one too, and it's often overlooked. If you snore heavily or wake up feeling exhausted despite a full night's sleep, that repeated disruption in breathing can significantly affect your morning blood pressure. Kidney disease, chronic stress, and poor quality sleep round out the list of factors that can make that morning surge more intense. If several of these apply to you, it doesn't mean something bad is going to happen. It simply means it's worth keeping a closer eye on your numbers and mentioning the pattern to your doctor. So when should you actually be concerned enough to reach out to a healthcare professional? If your morning readings are consistently high, not just once in a while, but day after day, that's worth discussing with your doctor.
Occasional symptoms like a headache, dizziness, or blurred vision alongside high readings are also worth mentioning at your next appointment. However, there are certain symptoms that should never wait for a scheduled appointment. Chest pain, pressure, or tightness, sudden difficulty speaking or understanding speech, numbness or weakness, especially on one side of the body, severe headache unlike any you've had before, trouble breathing. If you or someone near you experiences any of these, especially alongside a very high blood pressure reading that calls for emergency medical care right away, please don't wait it out. Now let's talk about something a lot of people get wrong without even realizing it: how you actually measure your blood pressure in the morning. The way you take that reading can dramatically affect the number you see, sometimes more than you'd expect. Here's how to do it properly. Try to measure before your morning coffee, since caffeine can temporarily raise your numbers. Measure before breakfast and before taking your blood pressure medication, unless your doctor has told you otherwise. Use the bathroom first, because a full bladder can actually push your reading higher. Once you're ready, sit quietly for about 5 minutes beforehand. Don't scroll through your phone or watch the news. Just sit calmly. Keep your feet flat on the floor rather than crossed, and rest your arm at heart level, supported on a table or armrest. Avoid talking during the measurement, since even a short conversation can raise your reading. Take 2 readings, 1 minute apart, and try to measure at roughly the same time each day so you can track a real pattern rather than a single snapshot. This brings us to a few common mistakes that quietly throw off people's readings all the time. Measuring the very second you wake up, before your body is settled. Checking after that first cup of coffee. Crossing your legs during the reading. Talking on the phone while the cuff is inflating. Using a cuff that doesn't properly fit your arm. Checking only once and treating that single number as the full picture. And perhaps the most important mistake of all, noticing a pattern of high readings and simply ignoring it instead of bringing it up with your doctor. So, what can you actually do if your morning numbers tend to run high? Reducing sodium in your diet is one of the most well-supported steps you can take, since excess salt causes your body to hold on to more fluid, which increases pressure on your blood vessel walls. Pairing that with more potassium-rich foods, like bananas, leafy greens, and sweet potatoes, when appropriate for your health situation, can help your body balance sodium more effectively. Maintaining a healthy weight matters too, because carrying extra weight makes your heart work harder with every single beat, morning included. A daily walk, even just 20 to 30 minutes, has been shown to meaningfully support healthier blood pressure over time by improving how efficiently your blood vessels function. Sleep deserves special attention here. Poor sleep quality is closely tied to a stronger morning surge, so improving your sleep routine, keeping a consistent bedtime, limiting screens before bed, can genuinely make a difference. Managing stress matters for the same reason. Chronic stress keeps cortisol elevated more often than it should be, which can compound that natural morning rise. Avoiding smoking, limiting alcohol, staying well hydrated throughout the day, and simply taking your prescribed medications consistently, exactly as your doctor recommends, all contribute to steadier numbers over time. None of these habits will work like a switch you flip overnight. They work gradually, the way most meaningful health changes do. So let's bring this all together. A rise in blood pressure when you wake up is a normal, expected part of how your body works. Your hormones are simply preparing you for the day ahead, and for most people, this is nothing to fear. What matters far more than any single morning reading is the overall pattern over time and how consistently elevated those numbers tend to be. If you fall into one of the higher risk categories we talked about, or you've noticed your morning numbers are consistently high, that's worth a conversation with your doctor, not a source of panic. And if you ever experience sudden, severe symptoms, please treat that as the emergency it is. Try tracking your morning readings over the next couple of weeks using the proper technique we walked through. A single number rarely tells the whole story, but a pattern over time tells you almost everything you need to know. This video is meant to help you understand your body a little better, but it's not a replacement for personalized care from your own doctor, who knows your health history and can guide you specifically. If you found this helpful, consider giving it a like, subscribing for more videos like this one, and sharing it with someone who checks their blood pressure every morning and wonders the same thing you once did. Take care of yourself, and I'll see you in the next video.